Hi everyone, we're going to talk about nutrition in chapter 10. I encourage you to read this chapter. There's a lot of good information. Some of it we are not going to go through, but I'm going to hit a few highlights here in this beginning part and tell you what to look at that we won't be talking about. We all know that good nutrition is the foundation of good physical health and mental health, and for little ones to develop properly. As part of being a pediatric primary care provider, it's one of your goals to assess whether the child's nutritional needs are being met and to try to prevent any problems that may be related to nutrition. There are standards in place to help prevent any physical illnesses. One of those is the recommendation that breast milk is the best food for babies, and the American Academy of Pediatrics recommends exclusive breastfeeding until about 6 months of age, and then continued breastfeeding with supplemental appropriate foods up to a year of age or longer, as long as mutually agreeable by mom and baby. Other important standards for children's diets is that it should include a wide variety of vegetables, whole grains, fruits, veggies, lean meats. These foods should be iron rich, especially for infants and adolescents. It's important to have healthy fats, and other fats, that intake should be limited. Trans fats should be eliminated from the diet. There should be a limit to simple carbs. Adolescent girls need extra calcium, iron, and folic acid. And all children's diets should include adequate fiber. We are not going to go into the specifics of nutritional requirements such as energy, water and electrolytes, macronutrients, micronutrients, vitamins, etc. I encourage you to read those pages in the book and to look at the charts that are provided. As with everything that we're doing, it's important to get a good nutritional assessment. We all know that eating is a social and cultural experience, but it also is an economic activity, and you are going to find children whose parents are not able to afford to provide them with the necessary nutrients, good food that they need. It's also important to know the nutritional status of a mom during pregnancy. If there were issues with mom during pregnancy and her nutrition, those may be seen in your infant as well. When you're making an assessment, it's important to know more about the child's food intake, what type of foods they're eating, if there's a special diet, the amount they eat, and any supplements they take. And this also is important to know more about the family's diet, because parents control what children eat. It's important to know a little bit about the eating patterns for an infant, how often they're eating. Are they doing bottle or breast? Are they on demand? Is it on a schedule? For toddlers and school-age children, do they sit down to meals? Do they eat on their own? What is the amount of time or meals per week that they eat out? It's also important to know a little bit about the family's attitude about foods. What are their likes, dislikes, cultural beliefs, family knowledge of nutritious foods? And management of meals is important. You need to know who's in charge of meals, who does the grocery shopping. Are they someone that enjoys cooking, or are they going to be providing more processed foods, less fresh fruits and vegetables, etc.? And it's important to know more about the economic and environmental factors in which your child lives. If you have someone who is living in a shelter, they are not going to have the ability to prepare foods. If you have someone that is having economic issues, they are going to not be able to afford to shop the perimeter of the grocery store and are more inclined to do those more processed foods that are cheaper and easier to prepare. For the physical exam of the little one, these are pretty standard things that we check. You want to know how their growth pattern is and compare against recommended growth patterns. You want to know what their BMI is. Their skin and hair will tell a lot about their nutritional status. You want to assess muscle tone, mucous membranes, and then further assess for teeth, neck, abdomen, CV, neurological, and any unusual behaviors, because these could impact their ability to eat. If based on your physical exam you have a child that you're concerned about and feel you need to get more information about their nutritional status, some diagnostic tests that you may run would be hemoglobin and hematocrit, an iron level, albumin, nitrogen balance, minerals, lipids, and then do a comparison of their bone age and their height age. And height age is the age at which 50% of kids reach their parents' height. So nutritional education is going to be something that you will be discussing with your patients when they're the appropriate age and your parents. You're going to educate them on fresh foods are always better than processed. If there's concerns for weight issues with little ones, it's better to eat less food, mostly plants, and to exercise more. It's important in the toddler and preschool years to talk with your parents about the critical time that it is to establish good lifelong eating patterns. And so a lot of that is going to be trying different foods, different fruits and vegetables. Having a wide palate will provide good overall nutrition and good minerals and vitamins. Feeding on demand is important during early infancy, but as the child is getting older and into the toddler and preschool years, feeding should not be used for comfort. That can lead to increased calories and concerns with being overweight. And also bottle feeding greater than 12 months increases the risk of weight issues in children. It's important that parents should respond promptly to feeding cues and allow the child to initiate and stop feedings when they feel full. It's important that kids feel that they have some abilities to choose when it comes to food, so insisting that the child clean their plate is something that parents should try to avoid. And then children will do as parents do. They'll eat what parents eat. So if parents set a healthy example, children are more inclined to follow that. And if there are healthier options at home, then children are more inclined to eat those healthier options. Many parents may come to you and say, how much do I eat? Feed my child what's appropriate for them to eat. And the recommendation is 1 tablespoon of food per year of age. And we all know that children may reject foods many times, so it's important to expose them to different foods that they might not previously have liked. They may need to be exposed to something 15 to 20 times before they decide if they like it or not. You also want to educate your parents on the importance of physical activity for children and adolescents, and the recommendation is 60 minutes of physical activity daily. It's also important to make that activity something that is interesting to the child, and it doesn't always have to be structured, but being outside, running, swinging, playing basketball, soccer, etc. can meet those needs as well. So if you have a little one that is bottle feeding, here are some recommendations of the from how old they are to the number of feedings to the ounces per feeding. So let's just take an example. You have an infant that's 1 to 3 months old that is being bottle fed, and they're going to take anywhere, or recommended to take anywhere from 5 to 7 feedings a day and 4 to 6 ounces with each feeding. This chart gives you the recommendation of normal daily weight gain based on age and the calories per kilogram per day of the child. But also know that breastfed babies put on weight at a little lesser amount than bottle-fed babies, and it's about 0.65 kilograms less than a formula-fed infant during the first year of life. Since we're talking about calorie needs, let's go on and talk about adolescent growth. And so we know that there can be growth spurts in adolescence, and these are based on the child's activity and weight already achieved. But for girls at about 12 years of age, they need about 2,400 calories per day, and boys about 14 need about 3,000 calories per day, and both need to have increased iron food to help with developing increased iron stores. So with little ones, solid foods are typically introduced at about 6 months, and it's important to introduce one food at a time. If the parent is wanting to give juice to the infant, it's important that that's limited to 1 to 2 ounces per day of fruit juice. It's also important that if they're offering fruit juice to cut that in half with water, and that will also help with that to have that sweet fix associated with fruit juice. And if they're wanting to make the best option possible, it's much better to eat their fruit than to drink their fruit. So encouraging, fruits to be eaten either by fingers at the appropriate time, or using fruit as baby food is better than giving fruit juices. And generally, the rule of thumb for toddlers is 1 tablespoon for each year of age per meal with the family. You may have parents that are introducing a vegetarian diet to their children, and it can be beneficial for several different reasons, whether it's choice or to help lower levels of obesity due to concerns for blood pressure, heart disease, diabetes, or cancer. With these little ones, it's important to monitor for deficiencies in protein, vitamin B12, D, and iron. And vegetarian diets can fall into different categories. There can be vegans, lacto-vegetarians, lacto-ovo, and then sometimes vegetarians. So it's always important to assess what falls into their diet and what does not fall into their diet. Food choices are important for children, and we need to be aware though of any extra eating that is going on. Often those diets can be filled with chips and sugar and processed foods, and that can lead to more chronic health problems down the road. Iron needs to be calculated to be about 1.8 times higher in those that eat meat due to the availability of vitamin B12. Iron absorption, as we talked about in the hematology lecture, is enhanced with vitamin C foods, so making sure that there's good vitamin C intake in the vegetarian diet. And if you as the practitioner have concerns about the nutritional needs of a particular child, it's important to refer for a nutrition consult. So let's talk a little bit about disorders requiring increased caloric intake. They're on page 177 in box 10.3. There is more information on criteria for nutritional referral, but we know that there are certain diseases, both acute and chronic, that can require increased caloric intake, and those may be immunodeficiency issues, a child that is running a fever, having a burn, frequent infections, or recent surgery. Some chronic issues may include a congenital heart disease, prematurity, Crohn's disease, or cystic fibrosis. With these kids, it's important to find out a little bit more about their food intake, the type and the amount of food, and what liquids they drink. If eating requires physical effort, and how long does it take for that child to consume a meal. If they're able to eat in 15-20 minutes, that is not going to tax them as much as if it takes a full hour or longer to eat a complete meal. Assess for any oral or swallowing dysfunctions. Assess for the position that the child eats in, as there are, for infants especially, better positions for the child to naturally get food into the stomach, as well as for toddlers. Our food is going to get into our digestive tract more effectively and efficiently if we're in an upright position versus laying flat. It's also important to know what the family's views of nutrition and meal times are, and to assess what the likes and dislikes are for food for the child. On physical exam, we're going to do body measurements. You're going to evaluate a feeding evaluation if necessary on how well they're able to swallow. It's important to calculate weight loss, linear growth, and any changes in and measure head circumference and notice any changes in weight loss. It's important to assess for skin color, tiredness, infections, if there's issues with delayed healing, or if there's any reported issues of school performance, if there's been a drop in grades. Diagnostically, you may be checking a ferritin and transferrin level, CBC, chemistry, thyroid, bone age. You might check a urinalysis and also do a stool specimen. If you're noticing that there are severe deficits, that will require referral. If you're finding that your child is not getting calories in as necessary, there's creative ways, and you may just have to try to tailor that to that particular child. It's important, if we're having nutritional deficits, to be taking multivitamins and mineral supplements. Assessment of children that are not gaining weight is important. So for infants, doing a weekly weigh, check their length and head monthly, and for children greater than 2 years old, checking a height and a weight monthly is important, because we know if there's nutritional issues, we can have growth issues and developmental delays. So on the flip side, let's talk a little bit about disorders requiring decreased caloric intake. Conditions such as obesity, Prader-Willi syndrome, myelomeningocele, Down syndrome, spina bifida, and hypothyroidism. This list would need to include any disorder or disability that decreases energy output and puts the child at risk for increased weight. Obesity is very common in children with Prader-Willi syndrome, and that is a condition where the child has more hypotonic muscle strength and may demonstrate dysphagia and failure to thrive as an infant. We know that children with Down syndrome typically have a shorter stature, and so they may have a low weight to height ratio. And as a result of this lower resting metabolism in Down's kids and or their hypothyroidism, they may require fewer calories than a child without the syndrome, and putting on weight can be common. And about 50% of children with spina bifida can have excessive weight gain. As we're continuing our workup on this child who needs decreased caloric intake, it's important to assess what their level of physical activity is. Assess more of their diet and meal patterns, what types of foods they're eating, what is the family's attitudes about foods and meals, are there any risk for being overweight, are there obesity issues within the family already. On physical exam, you're going to calculate their percentage of height and head circumference, height and weight. You may be doing skin fold measurements. You may do a mid-arm circumference. You're going to assess for a body frame type. Is there more central fat in the abdominal area, and what is the waist circumference? You may want to check muscle mass and also check BMI. So in a BMI in the 85 to 90% on the growth chart is considered overweight, and greater than 90% is considered obese. Some labs that you may check to tell a little bit more about their physical health, such as a blood pressure, blood sugar, lipid panels, or a liver function test, are important if we're having concerns for being overweight or obese. Management of these kids is referred to a dietitian to establish appropriate caloric needs and intake. It's important that they're having multivitamins and mineral supplements. There needs to be education for the parent of the risk associated with obesity. They need frequent support and monitoring of weight, and to support them with positive words. Let's talk about, we're almost done here, so I'm not going to finish out this yet. Let's talk about disorders requiring restricted or supplemental diets. And these are usually seen with kids that have multiple issues. These kids may have issues with body metabolism, requiring having issues with hormones, enzymes, or cofactor activity, and when these are out of balance or not enough, then absorption of nutrients can be limited, and the nutritional status of the child can be at risk. We're not going to go into these in detail, but look at the pages that are here on this slide and review those boxes. So let's talk a little bit about obesity. We know we are a society in America that suffers with obesity, And when there's a childhood onset, it can become very difficult later in life to control. And then all of the medical conditions that can be associated with that are something that then children are exposed to versus what we typically see with adults. We know that excessive fat tissue is the hallmark of obesity and being overweight. And it also can be due to an increase either in the size of fat cells, which is called for hypertrophy, or the number of fat cells. And if you have a child that has onset of being overweight, that is hyperplastic, so meaning the number of fat cells, is especially difficult to control because fat cells can be reduced in size, but the number cannot. And therefore it makes it easier to regain weight that may be lost. We're seeing an increased incidence in obesity in infants and toddlers. And so for your 2 to 18-year-old, if they have a BMI in the 95th percentile or above, or a BMI greater than 30 or above, that's considered obese. And then between 85 and 95% is considered overweight. There are some predictors of obesity that we can be in tune to, such as a rapid weight gain in infancy from birth to 5 or 6 months of age. If there's family predisposition to being overweight or obese, and unhealthy foods attitudes, if there's increased stress of the child, if this child has decreased physical activity and increased diet, then we know that there's the predictors of obesity. And we know that since the 1980s, as we mentioned earlier, obesity has increased significantly, but the physical activity levels of our kids has remained essentially the same. So physical activity is being the key component for both kids and adults on keeping them moving and keeping obesity down. Other predictors of obesity include environmental factors. If the parents suffer from weight issues and are obese, maternal smoking during pregnancy can lead to obesity. Bottle feeding, family stressors, using food to regulate emotions, social pressure to be thin, low self-esteem, abuse or neglect by parents, and also being of lower socioeconomic status, where concerns about finances to buy foods is a concern, then there is an increased disposition for obesity. So if you have a child that or an adolescent that is obese, it's important to do, as we've talked about previously, good history and physical, and we want to pay attention to eating triggers, making sure that they are not eating too much of their calories that they need to be, drinking too much of their calories. They need to be eating their calories. You want to be assessing for any psychological issues, doing some physical assessments, BP, lipids, blood sugar, and always get the child and or the parent's interpretation of what is a healthy weight and a body image, as these can be different culturally. In management of this obese child, adolescent, you need to be aware and know about the triggers and the perceptions that the patient or family has about it. Education about the risk, we've said this previously, associated with obesity. You want to do periodic assessments of what they are eating. Be sure and monitor for weight, blood pressure, and blood sugar and lipids, and then do a nutritional consult if needed. And on page 189, there's a good chart on box 10-12 that offers some parental guidelines for managing children with weight problems, such as responding to cues of satiation, what to serve, different things along those lines. So it's important that you be aware of all different management techniques that may be helpful to the parent in managing an obese child. And that will be the end of chapter 10. Thank you.